infections with 10 deaths reported in the county. Elvis Kosgei is speaking to the Health CEC in the county on measures that have been put in place. Let's listen in.
Thank you very much. Coming to you from Nzoia County. We'll be engaging the CC in charge of health, Claire Wanyama, just to paint a picture of what has been happening here in Nzoia County, the level of preparedness matters COVID-19. Thank you very much, Waziri, for joining us today. I understand that as a county you have prepared, really prepared. Maybe what are some of the expectations, what are some of the preparations that you've put in place to ensure that you combat the COVID-19 pandemic?
So thank you. In Nzoia, we have prepared ourselves first and foremost through the County Emergency Response Committee. We got 2 facilities that were gazetted eventually to work or act as isolation centers. These are Mount Elgon Hospital and the Teaching and Referral Hospital. We have 32 beds at Mount Elgon Hospital. We have also 5 ventilators and 5 ICU beds. We have trained our staff who are working with the patients who are COVID positive, and we have continuously given them the right trainings so that they are able to manage the patients of COVID. We have also empowered our surveillance teams, one, by giving them numbers, toll-free numbers, that are used by any suspect or suspected case, and they respond immediately using the vehicles that we have allocated to them. They respond to any call that comes saying we have a patient here who is showing symptoms, who symptoms meet the case definition. They respond immediately and go to pick the patient or to pick samples from the patient. In terms of empowering our communities on home-based care, which are protocols that were developed by the Ministry of Health, we have empowered community health volunteers and community health care workers to be able to respond in a manner as to patients who are in the communities. They stay at home, but whenever there is need for the medical teams to come or to seek interventions from the medical team, we get information through the community health volunteers all the way to the facilities, and we transfer such patients if need be. But what we have also done, we have ensured that we have purchased enough PPEs, and I want to take this chance to thank the Ministry of Health. They have continuously supported us. Like today, they have brought for us 1,000 assorted PPEs that will be used by our healthcare workers to ensure that they are taking the necessary precautions whenever they are handling patients, either patients who are positive or any other patient, because until one is tested, you can't tell whether they are positive or not. In terms of fumigation or sanitation and hygiene, through our public health team, we have continuously been fumigating and disinfecting our first and foremost our health facilities. We have also done that to the county facilities, and we are extending them to the markets, just to ensure that if the viruses are within the services of those facilities, they are continually disinfected to kill them, particularly using JIC. JIC actually kills 99.9% of the viruses. In terms of just our own healthcare workers, we have trained now over 800 workers, variously in the area of knowledge, to just empower them to be able, again, to handle. We continually partner with the Moi Teaching and Referral Hospital, again with the Ministry of Health, just to empower them. Our county reference laboratory actually is a testing center, and we want to thank His Excellency the Governor and the Ministry of Health for actually enabling us to be able to test. And this one has improved, especially on turnaround time, because now we are able to extract and test within our own laboratory, and we do it even for neighboring counties. that is maybe the challenges that we'll be having are just testing kits, but we continually partner with the Ministry of Health, and they give us more testing kits to enable us test all that want to be tested. Voluntarily, some who want voluntarily to test, and those also who meet the case definitions that we do for free. That is where we are.
Lastly, Waziri, your message of hope, and also have you sensitized some of the residents in Trans Nzoia County?
Yes, we have done sensitizations through our team called Health Promotion and Education Team. Our team has been training, and we've been supported by the Ministry of Health and partners just to ensure that we are going around the entire county, sensitizing the public on the protocols that are required to ensure they are, washing hands, social distancing, using sanitizers, wearing the right masks in the right manner, and so on and so forth. So all these containment measures and requirements, our health promotion and health education team do the education bit, and we have done it, and we continually to do it. What has slowed down that aspect has been lack of resources, and I think we are all aware what has been happening in the ministry, what has been happening at the Treasury, and the stalemate at the Senate. But we are lucky now. I think that has been overdone, and I think the county allocation for revenue bill has been signed into law by His Excellency the President. So we are happy that money will start flowing. Of course, challenges also are issues of salaries. We have had our medical doctors who are on strike, but the salary is beyond us, and we are appealing to the doctors, go back on duty, we'll resolve the issues as they come, and we are addressing them in the best manner we can. We are negotiating with the doctors. We are just about to have a return to work formula with them, and we want to thank all the partners who have been with us, especially the County Public Service Board that has been spearheading the negotiations.
Thank you very much. That was the CC in charge of health here in Trans Nzoia County, outlining some of the issues that are affecting residents here and some of the tough and innovative measures the county government of Trans Nzoia County has put in place to ensure that they combat the COVID-19 pandemic.
Indeed, and thank you to Elvis there. Let's now take you to Nakuru County, and a family in Engashura Bahati has known no peace for the last 3 weeks. This is after their two kids, aged 37 and 39, went missing without a trace. Moses Kamau, who was a businessman, and his brother Joseph Ngugi, a teacher, are said to have been in the company of an unknown third person. The family has been